Okay, and welcome and good hello and good afternoon. It is afternoon, 'cause this is a recording. Good afternoon and welcome to another Macular and Me webinar hosted by the Macular Society. As you know, we run two of these webinars each month. We run one which covers everything about AMD and all those kind of things. But in this session, we talk about things that affect people of a working age and with macular dystrophies. We've been running these for ages now. We've got a massive back catalogue of videos which are available on our YouTube channel and on the Macular Society website. So this is another one in our fantastic series. So today we're going to be joined by an ECLO, and our ECLOs are my favourite people in the eye clinic. It's really important to know about your clinical stuff, but an ECLO, an eye clinic liaison officer, are what as far as I'm concerned, are the next best thing to sliced bread. I think they're brilliant in the eye clinic. So we're joined by an ECLO from Cardiff, who's Ruth Rhydderch. So good afternoon, Ruth. How are you doing?
I'm very well, thank you. It's nice to speak to you from for the first time in about 500 years, a sunny Cardiff.
Oh, it's sunny, isn't it? It's such a nice day today, isn't it?
I
It's
know it's a bit
absolutely.
sad to be. I'm stuck in clinic. We have no windows, but I'm reliably informed that the sun is shining, so that's all good.
Well, we digress because it's sunshine and the sunshine. Okay, fabulous. Okay, so we just I like ECLOs, as I say. I think they're brilliant. I think the inception of them is fantastic. So I think the best thing we could do probably is just start off. What is an ECLO then? What is an eye clinic liaison officer, Ruth? What do you do?
Well, it is interesting because it's a bizarre title, isn't it, really? Because everyone thinks as a liaison officer, I can book their appointments and arrange their surgery and all sorts of weird and wonderful things, but that's actually nothing to do with the role whatsoever. The key bit is liaison. I'm kind of in the middle, if you like, the sort of hub with lots of spokes to lots of different places to make sure that the patients get linked up to all the right support services, but also from the point of view of a bit of a link between the patient and the clinical staff, because I'm sure you're aware that eye clinics can be pretty daunting, overwhelming places at times. And if you're getting a load of information thrown at you, they can be it can be tricky to take it all on board. So I have a bit of a dual role. I need to demystify stuff and put things in plain, simple English for people so that they, or Welsh, as I'm apparently
Yeah.
able to do, but also just to make sure that patients have that good link between themselves and the services in the community. Because as I say to patients regularly, that even though it feels like you're in clinic for weeks on end, you're actually only here for maybe a few hours now and again, but actually your whole life is out there in the real world, and it's really important that you have good access to services and that you know what they are and understand what can be offered to support you, whilst also understanding and being able to take ownership of your own eye condition, because that's hugely important. Because if you don't understand why you're coming to clinic, what we're doing here in clinic, why decisions are made in a particular way, you really can't really kind of get your head around that very well. So I'm not clinically trained. I'm not a doctor or a nurse or an orthoptist, but I have a level of understanding that allows me to hopefully make sure patients understand things in a way that makes sense to them.
It's so important, isn't it? Understanding your condition.
Oh, yeah.
You know, as you say, it gives you a level of ownership. So, is it? Do you find that people find it beneficial when you actually kind of explain? So we're the Macular Society, of course. So
Yeah.
we were talking about AMD, for example, which I'm sure is the
Yeah.
majority of the people that you talk to. So do people find it beneficial to understand a little bit more about the diagnosis and
Yeah.
potentially, you know, the things that they can expect in the future?
Yeah. So I mean I've been in ECLO for 10 years now, and it feels quite often you see people having light bulb penny drop moments when something that maybe has been going on for months or years finally makes sense to them. Um, and be that understanding the treatment. I do this analogy of kind of what wet AMD is, what dry AMD is, what those horrible nasty blood vessels are like, and I think it kind of loses it a bit when I start describing the injections as weed killer, but they kind of get what we're talking about.
Yeah,
But just seeing that kind of moment when people go, "Oh right, I understand that now," or "Nobody ever explained that to me." Now, sometimes that's genuinely because nobody ever explained it to them, or because they did explain it to them, but it was in big words that didn't really kind of compute, or it was at a point in time where, quite frankly, it was just all too overwhelming.
yeah,
So, sometimes something as simple as explaining what the macula is, what bit of it vision it impacts, and the great fear of I'm going to wake up one day and all my vision will have disappeared because I've got macular degeneration. And we try and explain that no, it's your central vision. And sometimes just a look of utter relief on people's faces when they understand that, or when they can understand why we need to give them treatment regularly, what it's actually doing, but also what the limitations of the treatment are, and things like that. And just sort of just seeing somebody, they'll come to you and they'll say, well, the doctor told me this. And when you listen to it, you think, no, I understand what the doctor was trying to tell you. And you break it down for them into much easier, simple language. And they're like, oh, I can stop worrying now. And you're like, yeah, that's the key bit. I always say to people before they leave the clinic, they have my contact number. I say, don't stew, because I am a terrible stewer. I will
Mm.
lie at night with things going round in my head, which in the cold light of day really aren't worth worrying about. And if someone just explains things to me, so I think that's hugely important.
Yeah, I think that people can be quite stoical, can't they? And
Yeah,
they'll put off asking that question. And
yeah,
and it's I think one of your key roles as an ECLO actually is to sometimes answer those questions, because, as you so rightly say, when you have a diagnosis, it can be overwhelming, and there's loads of questions that you should have asked, but you forgot
yeah,
to ask because
yeah,
you're getting bombarded with what is quite a traumatic, can be
yeah,
or feel like quite a
yeah,
traumatic thing. So
yeah. I mean, my abiding memory is of being a patient, not a patient, in a parent of a patient in a slightly different clinic, but nevertheless, a family member having a diagnosis, and them saying, "Any questions?" And I must utter that phrase about 20 times a week. And I sat there and looked at this person and thought, well, I don't know. I don't know what I don't know. I don't
yeah,
know what. Do you mean? And that moment, I just thought, oh, right.
yeah.
And that's something I've learnt over the years, is just having that open-ended any questions comment, question, whatever, isn't always helpful. You
Mm,
have to maybe I kind of now, after 10 years, know the key themes that tend to reoccur. Everyone's different, everyone's an individual, but sometimes if you just ask them about something that's a key theme, that then triggers more, it gives you an opening, and then they suddenly think, oh, right, oh, yeah, yeah, I can't do, oh, that's a bother, that's a worry. And it's sort of having that knowledge base to sort of nudge the conversation in that direction is hugely important,
mm.
because otherwise you just say any questions, they go no, and off they trot home, and they get probably 10 feet down the road and think, oh, why didn't I ask about this, and what did they mean about that? And I think that's the other key bit of me, is that I always give patients my contact number. They can ring me whenever they want. It's not a problem. They can come back to me and ask questions whenever they pop into their heads. Whereas if you're waiting and storing up these questions for your next doctor's appointment, you might wait, you know, months, weeks, for before you're due to come back and see somebody. And I think having that avenue to literally be able to pick up a phone and go, I'm worried about this. What did that mean? At any point is just, and it's a time saver. The doctors often will go over the information once or twice, but they have a busy clinic with 20 patients sitting outside. So it's really important to offer the option of time that isn't dependent on those clinical needs.
Yeah, I think, well, we'll come back to those key themes in a minute. I think
Yeah.
that'll be a good thing to talk about. But so how does someone get in touch with you from a clinical point of view? So they've been in to see their the consultant or a registrar, had their appointment. So what happens next? How do they find you?
So, most clinics have an ECLO, but not all. So the first question to ask is, ask one of maybe the nursing staff, healthcare assistant, reception staff, or even your doctor when you're speaking to them. Just say, does the clinic have an ECLO? Is there somebody here that I could have a chat with? Often, if you're working in a clinic where there's a well-established ECLO service, they will spot that you're likely to need to speak to someone and point you in their direction. But that doesn't always happen. So it's just that question is worth asking whenever you go for a clinic appointment. Just ask the nurse. Even especially the useful person to ask quite often is the nurse or the healthcare assistant doing your vision check when you arrive. But
Hmm.
I know here, say in our unit, I've had medical photographers bringing me patients. I've had the receptionist asking me to see someone, a nurse, a doctor. It really varies. Some clinics will have a big poster up with a contact number on, or they'll have some contact cards dotted around that you can pick up. And your best bet is just to ask a member of staff, is whoever it is Ruth there today? Is she around? Can I have a chat with her? And then if I'm in clinic that day, one of the nurses will come and grab me and say, "Oh, can you come and have a chat with this lady, or can you speak to her at the end of her appointment, or whatever?" And that works really well. If you ask and nobody's sure and nobody can really tell you what's going on, that might mean that there isn't an ECLO in your clinic, or
Yeah.
it might mean that you have, sometimes some hospitals, because they're quite small units, have someone who maybe only comes one day a week or one day a fortnight. So it's worth then, one of the easier routes to find out is the RNIB helpline keeps a big list of all the ECLOs all over the country, and
Yeah.
they can let you know. But they may even, if for example your unit's a really small one and doesn't have somebody, they may well be able to put you in touch with someone at the nearest unit who, whilst not being there and being able to see you face to face, may well be able to give you some telephone contact and some support.
So, and you're not always known as ECLOs, are you? In some clinics, they're
Yeah.
called sight loss advisors, aren't they? So,
Yeah, and
yeah,
there are some variations,
yeah,
but often if you ask, is there someone who works here who offers sort of advice and support for patients with low vision or visual difficulties, they usually, I mean, I'm get called all sorts. I've been called an ECLO nurse, which is interesting. As an ex-nurse, I was never called anything fancy when I was a nurse, but now you know, I've been called. I've actually got on the system that I'm a nurse specialist.
right, okay,
Again, interesting. But they should, sometimes they call me the low vision nurse.
right,
So
okay,
it it can get tricky. But as long as you ask, is there someone here that sees patients and helps them when they're having difficulty with their vision? Somebody
yeah.
should know who to point you in the direction of.
Well, perfect. I think, yeah, there's a good spread, isn't there, across the UK of ECLO services across the UK. As you say, they're not in every clinic, but there is
No.
there are more and more of you, which is
Yeah,
great.
we're like
Yeah, yeah,
gremlins. We breed in
yeah.
the dark or
I know
something.
it's. I think it's brilliant. Yeah, yeah. Don't cover you in
Yeah,
water. Yeah, yeah,
yeah,
yeah, yeah.
no, quite. Here in Wales, we have pretty much total coverage. We've got somebody in every clinic,
All right, brilliant.
but they're not necessarily there every single day.
Yeah, it's great. So that your phone number or the phone number of your local ECLO is invaluable then, isn't it? So
Yeah,
because they've not
definitely.
in clinic. Okay, well that's brilliant. So I mean, as I say, I always, I mean, I've been diagnosed for many years now, I'm sure an ECLO would have been very useful for my parents at the time. So do you talk to sort of parents and carers and friends and family as well as the patient?
Yeah, so my service here, and I know that many of my colleagues are similar, is for anybody impacted by sight loss. So whether that's a parent, a child, a family member, someone who's a carer, the patient themselves, anybody can ask for some support, some information, some advice. I mean, I see patients from birth to, I think my eldest to date is about 105.
Okay.
Um, yeah, she was great fun. Um, but she was great. She didn't want to go into a nursing home because she didn't want to live with old people, which I thought was brilliant. Um, but a lot of my work with children is around the whole family unit, parents, grandparents, relatives. Often I'll be chatting and supporting, say, a daughter of an elderly patient who's trying to see how the land lies for getting support, or there's a spouse who's really struggling with with their husband or wife having sight loss, and they're struggling to look after them. It's basically anybody that wants to know about services, wants support, wants to understand how they can either live with their vision not doing what it used to do or what they'd want it to do, or whether that's a family member of theirs that's trying to support them. The ECLO service is there for any of them.
Brilliant. That's fan. It really is a holistic service. I'm a huge fan, as you can probably tell. So let's honestly, I can't tell you the amount of I met many ECLOs all over the UK through this role and my previous role at Action for Blind People, the majority of you guys have always been a game changer for so many patients. It's great, even if it's just finding me or the Macular Society.
Yeah.
It's great. What about those key questions? So what are the key what are the sort of main questions, you sort of areas people ask you about?
Um, so the biggie that impacts people and that they always ask me is, I'm having trouble reading. What can you do to help me? Reading, and by reading, I don't necessarily mean, War and Peace. I mean, I can't read my post. I can't read the instructions on tins and packets. I'm really struggling with that. And for some people more of working age, it's like I'm struggling to keep up in my workplace because I can no longer read things on the screen, and I'm really having difficulty. So that's something that I rarely meet a macular patient without them expressing some degree of difficulty or unhappiness about reading. That's kind of a huge one.
Yeah.
The second one I tend to have is, really basic fundamental stuff when you drill down. It's like, and people say to me, oh, it's silly that I'm moaning about this, but I get up in the morning and I can't make myself a cup of tea without spilling it everywhere and making a right old mess and scolding myself. And I'm running into all sorts of bother with that. And I've always said to people, there is nothing too small, too trivial that isn't worth at least looking at and talking about,
Yeah.
because quite frankly, I am a complete coffee fiend. And if
Right.
if my life became difficult making myself a cup of coffee in the morning, that would have me fuming. I would not be a happy girl, and I'm just like, that's fundamental. It's something really basic, making yourself a drink,
Yeah.
you know. So
It is
those sorts
simple
of
stuff,
things.
isn't it? Yeah.
Yeah, and conversely, whenever I talk to people about solutions, I always tell them the sorts of solutions that we tend to lead people to and point them in the direction of are really simple, small, straightforward solutions.
Mm.
There's no rocket science, there's no huge building works necessary. It's simple stuff.
Yeah.
The other biggie I get from macular patients, like I mentioned already, they will ask the question, "Am I going to go blind?"
Yeah.
And then we have to have a conversation around, sort of on a very basic level, what do they mean by blind?
Yeah.
Because for most of my patients, they have a huge fear that they will wake up and all of their vision will have gone. And it's important for them to understand macular degeneration and macular dystrophies, how they impact you, what the macula is. But also, it's really important for them to understand that were that to happen in the very unlikely event, there's clearly something else wrong and they need to go and see an optician.
Yeah.
Because what we don't want, and what is another big push for ECLOs as well, is encouraging good eye health in people.
Yeah.
Um, because often they start to feel, well, I'm being looked after in the hospital, so there can't be anywhere else I need to go. And I've got macular degeneration, so there won't be anything else they can do for me if I go to the optician. And you're just always reiterating to them that if something changes in their vision that they're worried about or that is unusual for them, to go and get someone to have a look at it, because it
Yeah.
might be something else different that needs treatment. And often with the patients with sort of mild dry macular degeneration, to remind them that if their vision gets significantly worse, that yes, that may be the dry macular degeneration pootling along, but actually it might have turned to wet macular degeneration. Someone needs to look at it and we need to get them into the hospital quickly for treatment. So we really do push good eye health, good regular checks with the optician, to get your prescription correct because we want to maximize the vision that you've got that works, but also for things like low vision aids, and also to monitor your general eye health because as we get older, other things can crop up that may impact on our eye health that is treatable and will preserve vision. So we do a lot of that. So that's one of the ones. And the other
So,
kind of question,
so can
sorry.
I just jump in here just quickly? Just so is that a point where you might mention Charles Bonnet syndrome, for example?
Yeah, we quite often on our, I don't know if this is universal across the UK, but on the new CVI that's just come out here in Wales, there is an actual tick box reminder for us which
Right.
says, have you discussed Charles Bonnet syndrome? Because um it's part of what we are encouraged to do with any patient that comes to us with sight loss, is to explain to them that they may encounter this thing called Charles Bonnet, they may have some visual hallucinations, what they are, and that's just a huge part of reassuring them that it's an unfortunate part of when
Yeah.
your vision's not going so great, but people just don't talk about it. There is such a huge thing about not talking about it because people are so fearful that if they admit that they're seeing things,
Yeah.
that they will either be told they're mad, that they have some hideous infection and need to go to hospital, or
Yeah.
that they have dementia.
Yeah.
So yeah, we have a pointer here, but it's important. That's part of definitely the wider kind of conversation, is to reinforce Charles Bonnet, what it is, and what it isn't. So if certain things do start cropping up, then that probably isn't, and you do need to go and see a GP.
Yeah. Well, we have
And
so the Macular Society has a through our counselling service has a Charles Bonnet therapy group now, which,
Okay. Oh, good stuff.
which is quite useful for lots of people. And you can refer yourself into that on the old website or just by calling the helpline. So,
Oh,
and what was the
cracking.
final thing on your little list of
Oh,
frequently
so the
asked?
other one that people will come and see me or they will phone me up pretty regularly about is, can I be registered? They want to know
Right.
whether they can be registered with regards to their site, and various things will trigger this kind of conversation. Often it's something like a welfare benefits application or a blue badge application. We had a real flurry of this a few years ago when the government generously decided to charge all over 75-year-olds for their television license.
Yes, very nice. Yeah,
Um, it was kind of them. Um, and lots of people wanted to know whether they met the eligibility at that point so they could be registered to claim the concession. But sometimes it's more of a sort of, well, where am I? Where am I at? Is my vision that bad? Or that,
mm,
or my daughter tells me I can't see a thing, but I think I'm all right. Do you think I should be registered? Kind of conversation.
yeah.
Um, and I'm a big fan of registration in the right context. And that probably
So
sounds a
far.
horrible thing to say, but
Yep.
I think that if someone is eligible, we should have the conversation and we should explain exactly what registration is and isn't.
Yeah,
And it should be as much of the part of the patient's treatment as injections, drops, whatever else we do to them.
yeah. I
Because
agree. Yeah,
years ago, I remember when I started here, I remember talking to one of the consultants, and they used to say, pre all the treatment that we now have for AMD, it was basically well, you've got wet macular degeneration, you're going to go blind, sign this piece of paper, and off you trot.
yeah,
And off they had to trot with no support, no information, and they'd just been told, well, you're a no hoper, basically.
yeah.
And I think even in the decade that I've worked here, we've really changed the conversation around registration. And we don't wait until someone has reached the last chance saloon. We look at when
Hmm.
they're eligible. And if someone has sight impaired level vision, we register at that. If it then deteriorates, we register them appropriately. And it is seen as an adjunct and an important part of their care and treatment by us as a unit. It's not an add on, it's not a give up, it's a come on, we can do this as well as look after you from a medical point of view. And I think I'm really pleased I've been able to work as part of that here. I think it's been a real change in direction and perception of registration, and I'm quite proud of how we see it here in the unit here.
I think it's brilliant. I think I agree with you completely. Registration as sight impaired or severely sight impaired is beneficial for so many reasons. Um, also it does give you a bit of ownership as well.
Mm.
You know,
Yeah,
because especially with a condition like macular disease, where sometimes you can feel a bit of a fraud.
yeah,
If you know, then actually clinicians agreeing that your vision is at a level
yeah,
where a bit of additional support might be required.
yeah,
Um, it's one of those things that people they do say to me when I have conversations about registration. They say, "Well, will it guarantee me a welfare benefit?" And of course, it doesn't, but it does help as well. So you know, it's a bit of
It's
certification.
an interesting conversation. I remember one of the
Yeah.
nurses here saying to me, I said, "Oh, we were just chatting because I'm the sort of person that I'll go back to a nurse and say, oh, you referred that patient to me. This is what we've done for them, just so that they understand the process a little bit as well." And she was like, "Oh, well, are they going to get that blind benefit now?" And I was like, "Sorry." And I was like, there is no blind benefit. I did actually blow their minds by telling them what the actual three concessions for severe sight impairment registration were. They were like, is that it? And I
Is
was
that
like,
it? Yeah,
yeah.
yeah,
But I said those three things can make a huge difference to
they
people.
can.
But that's not the key point. It's the assessment from sensory services and the
Absolutely.
onward support that offers. But yeah,
And the
I
protection under the Equality Act 2010.
oh,
So
just a little bit, just a little
just a
bit.
little bit. So yeah.
We've had to quote that on one or three or five occasions. It does crop up occasionally.
It
But
does. Yeah.
things around people being able to access their records and their letters in an accessible format, and just generally how we behave. But on the whole, I think we've seen a real attitude change. But it is interesting for some people, registration is they literally will sit and cry because it's the
Yeah.
end of the world. And for other people, it's almost like you take a weight off their shoulders because it's like, oh, I thought I was struggling. I thought it was
Yeah.
that bad. And someone else has acknowledged it now. So it's a real double edged sword from sort of from my outsider's perspective, definitely.
It's validation. I do agree. It's and again, but I think it's because you guys, you're at ECLOs, you guys have more time, don't you? So the clinicians can sometimes, they've got a set length of time. They do their clinical stuff, and then don't generally have, maybe not have enough time to have those more
Yeah.
extended conversations. So
And the clinicians are fab and they're
yeah, they are.
great.
They're
They
brilliant.
know
Yeah,
their
yeah.
stuff, but they don't know what I know, and I don't know what they know.
They
Do you know
know.
what I mean? And it's definitely
Absolutely.
play to your strengths. I play to my strengths. I'm not an expert on welfare benefits, but I
No,
know who is. I'm not an expert on lots of things, but that's the whole point of me, is to work out what experts you need and get you
yeah.
teed up with them.
Oh, see, well, you see my next question. So
Ah,
who are the kind of people that you signpost or refer people into then? Who are the sort of the
yeah.
external organisations? Who are those kind of people?
Okie doke. So, number one, the absolute biggie is sensory services or sensory team. They may have slightly different names in different local authorities, but they're part of the council provision, the actual statutory sector, sensory services, and anybody can ask for an assessment with them, but one should happen automatically if you're registered. And they're the ones which will have what is still quite often known as the rehab officer for vision impairment, the ROVI, attached to them, who is the person that will do things like your mobility training, cane training, that will look at things like helping you to keep your independence in the kitchen, with meal and drink preparation. So that's my number one. That's where I would refer the vast majority of people to if they haven't accessed that service before, or if they did many millennia ago and now they've experienced something new or having difficulty with something. Then it's variable. So I deal with children and families, like
Hmm.
I sort of said to you. So I would refer to what we call qualified teacher for vision impairment. So they're again part of local authority government sort of specialist teachers that assess and support children to help them through, not just from school or nursery, but from birth, to help with development and placements in schools, nurseries, and colleges. So, from the children's point of view, they're my biggie. And then it kind of goes then more into sort of voluntary sector. So you've got things like local societies. So I'm in a very weird hybrid position in that I'm employed by a local society but work within the NHS. So here in Cardiff, we have a local society that delivers a whole range of services called Sightlife. There will be lots of others in other areas that they do things like groups, activities, lots of things to help with social isolation, and
Mm.
they'll work with a range of ages and stages. And then you kind of go then more into sort of national and sort of local charities that may not be directly visually impaired, but some of them are. So I would deal a lot with the RNIB, their sight loss advice service, for example, help with things like welfare benefits, queries about technology, employment. So I'd kind of their services quite a lot. And then for some of my patients, I might send them to something like blind veterans if they've
Yeah,
been in the forces at any time. And obviously the biggie and the best, the Macular Society,
well,
can't miss them out.
of course, yeah.
But the Macular Society in particular for me is a really good resource for patient information.
Yeah.
The patients will spot those yellow leaflets from 20 feet, and they are
Mhm.
bang on the money because they are basic, simple. And I don't mean that in a critical way, I mean that in a really good way.
Yeah,
Key information, bite sized chunks, easily understood, and they're grand. So, things like that. And then the other one that would I mainly signpost to, but sometimes refer, is low vision.
yeah,
So
absolutely. Yeah,
we have a slightly different setup in Wales to England. I'm not sure how it works in Scotland and Northern Ireland, so apologies. But here in Wales, we have a wholly community optometry based uh, low vision service. So I will point my patients in the direction of the nearest to them geographically low vision optom that will be able to offer them a low vision assessment. But any ECLO will advise their patients to get a low vision assessment, to get someone to help them look at aids like magnifiers, lighting, bits and pieces like that, um, which can help with reading. But also, it's really important for them to understand how to use those aids, because if you just buy a magnifier off Amazon, it's probably not going to work because it's not powerful enough. But also, when you've got macular disease and your central vision's affected, someone needs to teach you how to use a magnifier well,
yeah,
because otherwise you're magnifying you're just trying to look straight ahead at something. You're just not going to see it. So there's a knack to using magnifiers, and it's also as well about managing expectations, because unfortunately, if your central vision deteriorates with macular disease, the fluency of reading that that you maybe had in the past is always going to be a tricky one. And it's about kind of saying, right, well, the magnifiers may well help you to get back to doing a certain level of reading, or slowly, or it might just be for things like reading the sell by dates on things. But those sorts of low vision aids can make a huge difference to people, and really kind of they'd be lost without them. And low vision basically means anybody who, with the best correction to their vision, i.e. they've got contact lenses or glasses, and they still struggle to read, and they need that little add-on from more magnification.
Yeah. So I think sort of across the country, the low vision services are a bit hit and miss, but it's always worth pushing for one, isn't there?
Yeah,
Because I think it's very important to understand your measurables, your clinical measurements, and understand what
yeah,
your condition is. But actually, it's equally as important to learn how to use the vision you have left
yeah,
well, and
yeah,
support it to get the best out of it, isn't it?
yeah. Because sometimes patients will say to me, "Oh, well, I don't bother going to the optician anymore because the glasses don't do anything for me," or they've told me there's no point. And it's like trying to explain to them what they mean is going back for an eye test and getting new glasses is never going to get away with the issue of your macular disease. But
Mm,
if you've got a good, correct prescription pair of spectacles on, the vision that you have got will be at its best, and that's really important. And like I said earlier, the whole thing about seeing an optometrist is that they will check your general eye health as well.
yeah, perfect, perfect. So there's quite a lot of people across the country are going to be very lucky and have somebody like yourself, an ECLO, in their area. But what do you suggest for those people that where ECLO services aren't quite available yet? Who should they contact? What's the best way forward for those kind of people that don't have access to an ECLO?
Yeah, it's a really tricky one, isn't it? Because it is a gold mine of information, as you said. I think the best bet would be is if you can contact, if you can, your local adult social services, and ask them, do they have a sensory team? The answer should be yes.
Yeah,
And also, is there like a local society? Is there somebody locally that supports people with vision impairment? You can also contact, and it would be a perfectly sensible thing to do, to contact the Macular Society or RNIB,
yeah,
because most areas will have somebody as a point of contact that will know that, for example, we have Adele here in South Wales. She knows where we all are. So she would know, say, for example, if, there was an area that maybe wasn't covered, who's in the next county borough, say, for
yeah.
example, and would put you in touch with the nearest person. So I would say, if you are aware of a local society, contact them directly. If you're not, contact somebody like RNIB's helpline or the Macular Society helpline and ask for some advice. Or you can contact your local adult social services and just ask what support is available locally for people with sight loss, and what's the best and easiest way of getting access to that.
Brilliant. So just to say who Adele is, Adele is our senior regional manager
Yeah.
the south of Wales.
Yes. And we've got
Uh,
Marion in the north of
and
Wales.
Marion in the north, and the Macular Society has got regional managers dotted all over the place, and you can just get hold of them through our website or through our helpline. So 0300 30 30 111, throwing it out there.
Yeah.
So
Definitely, because they will point you. They
yeah,
will know locally
absolutely.
what's available, and will be able to say, "Oh, right, okay, I know there's an ECLO there, or I know there isn't one there, but let's try it." They will find ways and means to get you to that support.
Yeah, yeah, perfect. So, I mean, we're coming to nearing the end of our time. So, what would be the sort of the three takeaways from this from an ECLO point of view? So, what are your three main things to think about ECLOs as
Okay. So, I would always say to anybody who comes to an eye clinic and they're worried, or they've got questions, or they've got concerns, ask to speak to the ECLO. Just sort of say, "I'd like to speak to. Is there somebody here? Can I speak to them?" Um, I think in the longer term, if you've already been in touch with one, or you know where yours is, don't ever sit at home worrying about things, because the number of times I have patients and they tell me they've been worrying about something for forever. weeks and weeks or months, and they've really lost a lot of sleep about it. And I'm like, that's something we can help with. That's, that can be fixed, that can be sorted, or at least we can find a workaround. The other thing is it's really, really important to keep on top of your appointments and to have good ways of making sure that you don't fall out the system. The system is vast.
Mm.
I mean, just here in Cardiff, it's huge. We see so many patients. And if you're not getting your appointment and you're worried, or your appointments seem to be getting further away from each other, now that might be a perfectly normal thing as part of treat and extend, that your appointments are getting further away. But if you're worried, you need to I know this is sometimes hard, and we don't like to make a fuss, and we don't like to be a nuisance, but this is one time in your life you can be as much of a nuisance as you want, as long as you do it nicely. Be nice to my colleagues.
Yeah,
But
absolutely.
because we sometimes have patients and they ring up and they say, oh, I haven't had an appointment for 9 months, and we're like, oh, they've been missed by the system somehow, or maybe they had to cancel an appointment because they weren't well, or they missed an appointment because they didn't get a letter, or any of those things. And I say this to my colleagues in the community all the time: if someone is worried that they haven't had an appointment or they've not heard, ring your local eye clinic, keep on top of things. If you're struggling with that, and if you do have an ECLO and you've got a contact number for them, give them a ring. It's, is it my job? No, technically it's not. But when patients ring me up and they say, I'm really worried, I haven't had an appointment for a while, it literally will take me a minute to ping an email to the lady that books the appointments and say, can you check what's happening with Mrs. Jones? She hasn't heard anything about her appointment.
Mm.
And 9 times out of 10, we can get it sorted. So it's really, really important that if you're worried or things change or you've not had an appointment for a while, that you arm yourself with some good phone numbers and good contact points so that you can chase those. And you know we would rather someone ring up about an appointment and chase it than for us to lose somebody and then for their vision to deteriorate. We don't want that to happen. We want to help you, but you've got to be on it. So that's hugely important. um if your vision is concerning you and you're struggling, let us know. We can look at whether you should be registered. But even if you can't be registered because your vision's not quite in those territories yet, oh, that was the other thing. When people ring up and they ask, "Can I be registered?" and if I try and explain to them, no, they can't. That's not me being bossy or horrible. That's
Yeah,
not me just deciding that I don't feel like doing the paperwork. There are guidelines, and the guidelines are set out by the Royal College of Ophthalmologists,
yeah,
and there is a degree of discretion,
yeah,
but they are guidelines that the consultants will adhere to. So if we say you're not in that territory,
yeah.
it's not because we're just being mean. It's
And
just
actually,
they are set out in a certain way. But if you
it's a
think
good,
you need to,
it's a
you
good
know,
thing.
yeah, so I did. God bless her. I had one lady once, and she said, "I want to be registered." I said, "Oh yeah, well we can. We fortunately, your vision, we've actually kept it ticking over quite nicely with those injections. They're not, it hasn't deteriorated very much, and that can be really galling because
Mm.
sometimes functionally you feel like your vision's got worse, but measurably not so much. um and she was actually quite upset with me when I told her that we couldn't register, and I was like, I kind of went, well, I'm really sorry, but I didn't mean it like that. I was like, oh, it's a real but
Yeah,
no,
it's tricky,
if you
isn't
think
it?
you
Yeah.
want to be registered, ask the question.
Always ask them.
Always
Absolutely.
ask the question, and it is, in most units it's really straightforward, and certainly here in Cardiff it would be seen as something that we would positively want to do for you to help you and make sure you can get as much support as possible. But if you don't want to be registered or you don't meet the criteria, we still want to support you, and lots of the help and services, in fact most of them, are perfectly open to you registered or not. Registration is
Absolutely.
completely voluntary. So always ask the question, always have good contacts, and keep on top of your condition. And I've forgotten what was the first one I said because I'm a woman of a certain age and my
No,
memory's
it's fine. Yeah, it's been great. Honestly, Ruth, it's been great. You've given us so much information. I mean, as I say, I think the ECLO service is. I think there should be an ECLO connected to every clinic in the UK. I really do. I think it's an invaluable service, and it gives people a place to start and to continue and a contact with the eye clinic, because it's sometimes hard to get hold of your clinicians, as we all know.
yeah.
So
I know, I've got to say I'm phenomenally privileged and phenomenally lucky because I really, really love what I do and I really enjoy it. And yes, there are days when it's less thrilling than others, but it is a really great situation when you can watch people go from a place that's not ideal in any way, shape, or form, or whether they when they're really having trouble with something really straightforward that can be ironed out, and then they come back to you months later and just are in a totally different place. It's
Yeah.
yeah, I'm really privileged.
Yeah, well, the people of the patients of Cardiff are very lucky to have you, Ruth. You're a very good ECLO. So thank you. So really, thank you for joining us today
No problem at all.
explaining everything. It's very clear. So we will be posting this onto YouTube and onto the website, which would be great. And so for everybody to see and for time immemorial.
Fame at last.
Fame at last, absolutely. So just leaves me to say again, thank you for watching. If you have got any further questions around your sight loss or any conditions you may have, you can call our helpline, which is 0300 30 30 111. All our Macular and Me sessions are now available on YouTube and on our website, so you can watch them to your heart's content. And maybe next time you go to the eye clinic, just check out whether there is an ECLO, because even just touching base with them, even if you don't need them, so if you do need them in the future, that would be a really good idea. So again, thank you for watching, and we'll catch you next month. So thanks very much.